You can walk out of a doctor's office with a smile, a handshake, and a report that says normal, and still be sick. Not sick like a cold, not sick like a fever, sick in a way you cannot feel, a way that does not hurt, a way that gives you zero symptoms while it sets up camp inside your organs for years. It is called Metabolic Syndrome, and 1 in 3 adults has it in the United States, the United Kingdom, Canada, Australia, across Europe and New Zealand. 1 in 3. That is not a random statistic. That is this screen, this room, this moment. Someone watching right now has no idea this is already happening inside them. In the next several minutes, I am going to give you 5 numbers. You can check them at home, tonight. No doctor visit, no expensive tests, just you, a measuring tape, and your last blood work. And if you find 3 of those 5 numbers are off, I am going to show you exactly what to do. 4 steps, backed by clinical research, completely reversible. Hit subscribe now so you can come back to this anytime, and share it with someone you genuinely care about. This is CorVita Doctor. Let's go. Metabolic syndrome is diagnosed when you have 3 out of these 5 markers. Let's find out where you stand. Number 1, your waist, not your weight, not your BMI, your waist circumference. Above 40 inches for men, above 35 for women. This is called visceral fat. It is not the fat you can pinch. It is the fat wrapped around your liver, your pancreas, your intestines. It behaves like a living organ, pumping out inflammatory chemicals all day long. Most people have never measured their waist. They step on a scale, see a number, and move on. But the tape measure tells a different story than the scale. Pause for a second. Do you know your number? Most people don't. Tonight, stand in front of a mirror, belly button level, do not suck in, do not cheat, write it down. Number 2. Triglycerides. This is on your lipid panel. Above 150 milligrams per deciliter or 1.7 millimoles per liter means your blood is physically thicker than it should be. Here is the part most people do not understand. Triglycerides do not come from eating fat. They come from your liver converting excess sugar and refined carbs into blood fat. White bread, pasta, sugary drinks, snack foods. Your body turns what it cannot use into sludge. But the next marker is the one that surprises most people. Number 3, HDL cholesterol, the good one. Think of HDL as your arterial cleaning service. It sweeps away excess cholesterol before it becomes plaque. Below 40 for men, below 50 for women, your cleaners have gone home, the trash stays. Number 4, fasting blood sugar, over 100 milligrams per deciliter or 5.6 millimoles per liter. And this is where things get really interesting. Your pancreas is working overtime now, pumping insulin, begging your cells to open up, but your cells are tired of listening. This is how diabetes begins, quietly, slowly, years before any diagnosis. What happens next inside the body is something most people never hear about. Number 5, blood pressure, over 130 over 85. Your heart is throwing punches against a wall with every beat, and that wall is your arteries. Each beat causes micro damage. Each day that damage accumulates. There is no pain when this happens, no sensation, just silent progression. The 5th marker may be the most dangerous of all. 3 out of 5. That is the diagnosis. Hundreds of millions across the Western world meet these criteria right now. And if you ask them how they feel, they will tell you they feel fine. Now let me show you what is driving all 5 of these at once. All 5 markers trace back to one single mechanism. Once you understand this one mechanism, every symptom suddenly starts making sense. Your body runs on glucose, sugar. But that sugar needs to get inside your cells. Insulin is the key that opens the door. Every time you eat, insulin is released. It finds your cells. It unlocks them. Sugar enters. Energy is produced. Beautiful. Now picture what happens when your diet is full of processed food, hidden sugars, refined carbohydrates at every meal. The key never stops knocking. Breakfast, mid-morning snack, lunch, afternoon coffee drink, dinner, late night snack, knock, knock, knock. Eventually, your cells stop answering. They are exhausted, they become insulin resistant, but your pancreas does not surrender. It makes more insulin, and more, and all that excess insulin begins causing damage of its own. It tells your body to store belly fat, it commands your liver to produce more triglycerides, it raises your blood pressure, it inflames your blood vessels. This is the vicious cycle, and most people stay trapped in it for years without knowing. And there is one more piece. Sleep. Sleeping less than 6 hours per night increases insulin resistance by 40%. Not 10, not 20, 40%. You can eat perfectly. You can exercise daily, but if you are sleeping 5 hours a night, you are actively making yourself insulin resistant while you lie in bed. The good news, your body wants to heal. Give it the right environment, and remarkable things can happen. Metabolic syndrome is not a life sentence. It is reversible, without medication. 4 steps. Step 1. Fix your plate. Clinical research shows that 80 to 90% of metabolic improvement comes from nutrition changes, not from exercise. Nutrition is the foundation. The Mediterranean diet has the strongest evidence base. Here is the simplest way to follow it. Half your plate is vegetables. 1/4 is protein. Fish, chicken, eggs, lentils. 1/4 is complex carbs, quinoa, sweet potato, brown rice. And eliminate liquid sugar completely. 1 can of soda has about 39 grams of sugar. That is nearly the entire daily recommended limit for an adult. Gone in a single drink. Liquid sugar is metabolic poison. Remove it. Step 2. Walk after meals, not hours later, right after, 15 minutes. When you walk after eating, your muscles pull glucose directly out of your bloodstream and burn it for energy. You stop that sugar from ever becoming fat. You do not need a gym membership. You do not need equipment. You need shoes and 15 minutes. Aim for 200 to 300 minutes of walking per week. Break it into small chunks. The consistency matters more than the intensity. Step 3. Move throughout your day. Scientists call this NEAT, non-exercise activity thermogenesis. In plain language, all the movement you do that is not formal exercise. Take the stairs, stand up from your desk every hour, walk around during phone calls, carry your groceries, park at the back of the lot. Each of these seems insignificant alone, but added together across a full day, they burn more energy than your dedicated workout. People who maintain a healthy weight without obvious effort are not magical, they have high NEAT. You can build this into your life starting immediately. Step 4. Protect your sleep. 7 to 8 hours, consistently. When you sleep enough, your hunger hormones normalize. Your stress hormone cortisol drops. Your insulin works properly again. Without adequate sleep, the first 3 steps are only half as effective. Sleep is not a reward you get after finishing your work. Sleep is the biological foundation your metabolism rests upon. Here is the number that should give you real hope. 10%. Lose 10% of your current body weight, and peer-reviewed clinical research shows that fat deposits in the liver decrease. Inflammation reduces. Even early scarring can reverse. Fatty liver disease, one of the most common consequences of metabolic syndrome, is curable, not manageable, curable if caught early. Clinical programs consistently show that patients lose 1 or more metabolic syndrome criteria within 6 months. Blood pressure drops, triglycerides fall, waist measurement decreases, blood sugar returns to normal range. This is not motivational talk. This is documented clinical reality. The protocol works when you work the protocol. But I will tell you the truth, it can return. Life happens. Stress, holidays, family emergencies, grief. People who drift back to old habits see their old numbers return. The people who succeed long term are not the ones who followed a diet for 6 months. They are the ones who built these 4 steps into who they are. This is not a temporary intervention. This is how you live now, and it is completely worth it. 4 steps. Fix your plate. Walk after meals, move all day, sleep, no pills, no gimmicks, no expensive programs. Science, applied consistently. Your homework tonight is simple. Take a measuring tape. Wrap it around your bare belly at your belly button. Breathe. Do not cheat. Read the number. Write it down somewhere, you will see it again. You cannot change what you do not measure. This is your starting line. And one important note, because we care about your health. This video is for general educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you have any concerns about your own health, always consult your personal doctor or a qualified healthcare professional. Never delay seeking medical advice because of something you heard in this video. Now, if this video helped you, don't keep it to yourself. Someone you love may need this information more than you realize. Share it with one person today. Hit like, hit subscribe, leave a comment. Even just the name of your country, I read them. Before you go, remember, every video on CorVita Doctor is medically reviewed by Dr. Rashid Ahmed, MBBS, so you can trust what you learn here and share it with confidence. Next on CorVita Doctor, cortisol face, how chronic stress physically changes the shape of your face and how to reverse it without a single skincare product. Subscribe and press the bell. That video is coming soon. Your body is the only place you have to live. Take care of it and help someone you love do the same. This is CorVita Doctor, medically reviewed, science-backed. I will see you in the next one.